Hey Betty, welcome back. It's great to see you again. So, first of all I have good news for you. You've done the right thing in coming to see us. After reviewing your x-rays and the series of exams we performed, I'm feeling very confident that what you have is treatable with chiropractic care. So the good news is you're in the right place at the right time. Now that we've established that what you have is treatable with chiropractic, I want you to know a few things about it before we get started. As you may remember from the video we had you watch, chiropractic is not new. It is not experimental, and it's been a successful form of treatment for cases just like yours for well over 100 years. In fact, the results of chiropractic have become so popular and so successful, it is now the second largest healing practice in the Western world. And what's most important for you to know is that a study done by WebMD following 2 million patients over a course of 4 years demonstrated a 95% satisfaction rating with chiropractic. 95%. Now let me tell you, in the medical world of healthcare, it's impossible to find better results than this. That's why you can feel very confident that you've come to the right place to find the solution to your healthcare problems. Now, one more very important thing that you need to know about your choice in healthcare is that chiropractic is natural. In today's day and age, this is becoming increasingly more important. Because let's face it, Betty, we're all becoming way too drug dependent. Your body's been made with this amazing capacity to heal itself that far exceeds anything that man could create. Like a drug. Your body is better than a drug, and we need to rely on it first. When your body has no nerve interference, it's more able to correctly diagnose and heal itself naturally. That's why your first choice in your healthcare journey should be one that's natural, not one that's heavily reliant on drug therapies with their harmful side effects and risk for addiction. That's not to say that drugs don't have their place, because they do. But they should be used as a last resort and not as a first. Now, let's talk about what brought you in here. Why do you feel the way that you do, and why do you have the pain that you have? I'm here to tell you that your issue didn't start yesterday, and it didn't begin the first moment you felt pain. Pain is actually one of the last indicators to the body that something's going wrong in the first place. In fact, your issue's been building up over a long period of time and is an accumulation of all the events in your life. Your issue began with the traumas of childbirth. Anyone that's seen a child being born can attest to the traumas that occur to the head, neck, and spine as we all go through this process. And it doesn't stop there. Think about all the hundreds of falls, spills, and accidents you've had from your childhood into your teenage years, and this has all been left untreated. You needed this care growing up. It's amazing that any of us live past the age of 5 with all those falls and spills our bodies take over the years. If you would have had this care growing up, it would have saved you from a lot of the wear and tear you're experiencing now. That's why if you have kids, if you're planning on having kids, they're probably going to live to be 100 years old, and we want them to be as mobile as possible throughout those 100 years. Now, let's talk about your lifestyle a little bit up to this point. Betty, it's impossible to count the number of improper lifts and physical traumas that have occurred to the body over this point. That's why we say it isn't just one event. You have wear and tear already. But keep in mind this is with no prevention, no treatment, no care, and no effort whatsoever to stop any of this issues from occurring in the first place. As an example, let's look towards the dentist. Imagine you never went to the dentist or brushed your teeth. Nothing. From the moment you were born to where you are now. Think about what kind of condition your teeth would be in. It'd be amazing to think that you'd have any teeth left in your mouth at all. Am I right? Same thing's been going on with your body. You have a lot of untreated nerve and tissue damage that's been building up over a long period of time. Now, it's taken time for you to create this condition, so it's going to take some time to get out of it. As another example, say we gained weight over a 10-year period of time. We all want it to be off in 10 days, right? But that's simply not going to happen. It's not how the body works. This issue took time to create, so it's going to take time to fix. But we'll talk more about the timing of your treatment as we move forward. Right now, I'd like to talk about where you are now. What are the results of all this untreated wear and tear on the body that has been left unchecked? Well, your spine has been pushed and pulled out of alignment, causing a decrease in flexibility, an increase in irritation, and a swelling and pinching of the nerves as they flow out from in between the individual segments of the spine, which we call vertebrae. Now, the medical term for this pinching is called a subluxation. And if you look at this chart over here, you can see some of the things that occur with subluxations in different parts of the body. And I think you'll find this part fascinating. The reason so much of your overall health is impacted by these subluxations is because the nerves flow from the brain to the different parts of the body and all the organs that are there. That's how your body knows how to function and heal itself properly. Now, you came in here today with low back pain, but I'm here to tell you if this is left untreated, it may lead to pain in the groin, pain down the legs, and even possible abdominal issues. This may already sound like some of the things that are occurring to you, am I right? The reason for this is because nerves work a lot like today's cell phones. When there's interference in a call, what happens? The call breaks up. And what do? We try to move to the nearest place we can to get rid of that interference, restore the connection, and get the whole message across. Again, something similar is going on with your body here. When there's nerve interference, your brain isn't able to communicate its commands to the rest of the body, and the result is pain and disease. That's why we say that subluxations cause more than just neck and back pain. They can cause other forms of disease as well. And when you remove nerve interference, you're more likely to experience greater health in other areas of your body. Does that make sense? Awesome. Now let's talk about the spinal degeneration process. There are 4 stages to the spinal degeneration process. Just like many other diseases have stages, let's use an example that we all know something about and can understand. Cancer. When you have cancer or other diseases, it progresses through the various stages when it's left untreated, and your overall symptoms and health become more severe. That's why it's super important we begin our treatment now, so that we can take care of you and get this under control. Currently, I'd put you at a phase 2 of the spinal degeneration process. Well, let's look at your x-rays so you can see a little bit more about what I'm talking about. Now, since you can't take these x-rays home with you, I'm going to circle on this chart here the part that most exemplifies where you're at, so you can take it home to your friends, families, and loved ones and show them exactly what we've been talking about today. Now, we've talked a lot about your issue and the problems and the causes of it. Let's talk about what you came here for. Let's talk about the solution. The solution for you is going to be a series of adjustments that I will perform over a course in time. With enough adjustments, we'll get your spine back in the proper alignment and get you functioning correctly. Now, there are a few things going on during these adjustments that you can't see. That's why I'm going to tell you about them. Number 1, I'm removing nerve interference so that your body has 100% capacity to heal itself from any current pain or illness you're in. Number 2, I'm removing nerve interference to help prevent any future sickness and disease from occurring, so that you don't get so sick to begin with. And number 3, I'm removing nerve interference for your future musculoskeletal performance, so you don't get so much wear and tear buildup, and we don't get back to this debilitating state. Now, a minute ago, I said I was going to take a series of adjustments. Did you catch that? This is for the exact same reason when the orthodontist is going to reach into your mouth and rearrange all your teeth back into the proper position on the first visit. They, like us, will tell you it's going to take a series of visits. And with enough time and with enough treatment, they'll eventually get everything back into the proper alignment. We're going to do the same thing here. The truth is, your body's been misaligned for so long, it actually considers this misalignment to be normal. We're going to have to retrain it. And again, this is going to take time. I'm going to adjust you, and your body's frankly going to readjust back to where it's used to being. Kind of like 3 steps forward and 2 steps back. But with enough time and enough treatments, we'll eventually get you back in the proper alignment, get your muscles working correctly, and get you feeling better. Now, let's talk about the healing stages that we're going to be going through. The first phase, and the most obvious phase, is going to be the pain relief phase. We want to get you out of pain. Now, everyone responds a little differently to this phase, but I'm going to be suggesting that we see you 3 times a week for the next 4 weeks for this phase. And we'll be supplementing your care along the way with various therapies so that you can get better and hold your adjustments better. Now, during this first phase, once we get out of it, you'll be thinking, I'm feeling great, awesome. I don't have any pain anymore, problem solved, right? Well, I'm here to tell you that that isn't the truth. What's going on is that at this point in your care, your spine will be very unstable. and any twist and turn that you may perform, anything at all that you might have normally done, may set you back to where you are now, or even possibly make things worse. That's why the second phase of care is even more important. It's the stabilization phase of care. Now for you, I'm going to be suggesting that we do the stabilization care for 2 times a week for the following 3 weeks. After that, before we get to that phase though, I'm going to do a short progress exam to make sure that you're ready and progressing as we expected and are ready for stabilization care. Once I think that you are, we'll get you on that treatment, get things working, and get you feeling better. Now, after the stabilization phase, we move on to the most important phase, and that's the wellness care phase. Before we get there, again, I'll do a short progress exam to make sure that you're ready for wellness care. Now, the reason wellness care is so important is because you never truly stop doing the things that give you stabilizations in the first place. And we don't expect you to. It's just like with your teeth. It'd be amazing if you could brush them one time and they stayed clean for your entire life. But that would mean that you'd have to stop eating. And we don't expect you to do that. Just like we don't expect you to stop doing all the things that make you you. We want you to be able to work. We want you to be able to do your daily activities. But this time, the difference is that I'll be providing a series of adjustments to make sure that your spine stays in the correct position so you don't get so much wear and tear, and so that you don't get back to this point where you're debilitated and having the issues that you're having now. In order to get there though, I'm going to need 3 things from you. The first is I need you to make sure that you make all of your adjustments. Just as I prescribed, don't miss any. Follow them down to a T. It's the number of adjustments and the frequency of those adjustments that make chiropractic work so well for you. Secondly, I'm going to need you to follow and